Thank you for tuning into OT Conversations. Today, we're diving into a recurring question that often plays in my mind, especially during multidisciplinary team meetings and discussions with colleagues. So what? And then what? This phrase has become a cornerstone of how I approach intervention planning. Let's say you're working in a critical care facility and you learn that a patient has had lung surgery, is experiencing heart complications, and their blood pressure is elevated. These medical updates are typically shared during an MDT meeting, but as an occupational therapist, my immediate thought is, so what does this mean for our intervention? And then what? These questions prompt us to look beyond the immediate medical facts and delve into how these issues affect the patient's daily functioning, engagement, and motivation. For instance, if a patient is on inotropes to regulate heart pressure, I think about the broader implications. They're on inotropes, so what does this mean for their functional stability? And then what are our steps to address any resulting complications? If I hear a patient is still on antibiotics, I consider what this signifies about their ongoing treatment and recovery. They're on antibiotics to manage an infection. So what? What does this mean for their ability to go home safely? This line of questioning extends across all areas of care. In a neurology ward, where focus might predominantly be on CT scans and brain statuses, I shift the perspective to functional outcomes. There's evidence of a partial anterior circulation stroke, so what? What does this mean for the patient's physical and functional capabilities? Understanding the state of the brain is useful, but as therapists, we need to translate this information into actionable steps for recovery. There's no medication that can reverse brain damage affecting limb movement, but we can implement strategies to enhance limb functionality and manage symptoms. This thought process leads to practical interventions. For example, if a patient struggles with upper limb movement, we focus on maintaining joint mobility and muscle length through splinting and other preventative measures. Concurrently, we emphasize restorative practices and everyday activities like personal care, which are vital for patient independence. Our role involves constant adaptation and innovation. If walking is a challenge, we consider assistive devices like frames or tripods. For more severe mobility restrictions, we may recommend a one-hand operable wheelchair or even a power chair, depending on the patient's needs and home environment. Then what? Becomes a repetitive, guiding question that drives our therapeutic approach, ensuring we always have a subsequent step to support our patient's recovery and daily life integration. In summary, let the questions, so what, and then what, guide your practice. These questions help us as occupational therapists to not just understand the medical aspect, but to focus on the functional implications, tailoring our interventions to restore, alter, modify, prevent, and support our patients effectively. Remember, everything we do as therapists has a profound impact on our patients' lives, one patient at a time. I hope today's discussion inspires you to embrace these guiding questions in your practice, making a meaningful difference in the lives you touch. Until next time, keep asking, so what, and then what, and take care, everyone. Bye.